On today's panel, we have Dr. Fermín Legend, District Health Officer, North Las Vegas Councilman Scott Black, who's also the chair of our Southern Nevada District Board of Health, Dr. Court Loaf, Director of Primary and Preventive Care here at the Health District, Joanne Rupiper, Chief Administrative Nurse here at the District, Chief Greg Castle, Incident Commander for our Incident Management Team, and Chief John Steinbeck from the Clark County Fire Department. At this time, we will begin with Dr. Legend. Thank you.
Okay, thank you, Corin. Well, good afternoon, and thank you for being here with us today. We want to make an update of where we are today with the vaccination campaign and our efforts with the pandemic. I just want to share with you that as today we have more than 970,000 people in Clark County who have initiated the vaccination, meaning that they have received at least one dose of the vaccine. That represents almost 53% of the eligible population that we defined at the beginning of the campaign. And also, we have already more than 758,000 people who have completed the vaccination, whether it is 2 doses of Pfizer and Moderna or 1 dose of Johnson and Johnson. In total, here in Clark County, we have administered more than 1,660,000 doses of vaccine. I also want to remind you that even so we are advancing with our vaccination campaign, our county suffered a lot because of the pandemic during the last 15 or 16 months, with more than 249 cases reported of COVID, and unfortunately more than 4,000 deaths here in the county. The good news is that the incidence of the disease, or the number of new cases that we are identifying daily since January have decreased. That decreasing tendency trend still is there. And also we have seen a dramatic decrease in the number of hospitalizations and deaths in Clark County. Our testing positivity rate is also coming down. Right now, today is at 4.8%, which is below the 5% recommended by the World Health Organization and the CDC as acceptable good levels of positivity rate, meaning that the transmission of the virus, even though it's still present in our community, is decreasing among also. That's really great news. I also wanted to share with you that yesterday we attended the Clark County Commission meeting, and the board of commissioners yesterday, they adopted the recently updated CDC guidance regarding the use of masks, and just to follow up with that, the county commission decided to end our current COVID-19 mitigation and enforcement plan effective June 1st. So this is something that obviously county officials will be sharing with you in more detail, but we just wanted to make sure that we share that with you. And the decision to just stop the plan by June 1st is based on, again, the really good levels of immunization that we're having here in Clark County, and also, of course, what is happening across the whole United States, where, as we know today, more than 60% of the adult population of the United States has at least received 1 dose of the vaccine. Uh, I also wanted to tell you that even so, the mitigation plan will stop in June 1st. It still is very important for us to keep our efforts with the vaccination, and it's important for those individuals who have not been vaccinated yet to take the opportunity of receiving this vaccine at any of the many vaccination sites that we have across the county. We currently have two main sites, uh, Las Vegas Convention Center, and also we are offering a drive-through at Texas Station. And then there are multiple pop-up places where we are offering the vaccine across the county. So the opportunities there, the waiting time for the vaccine is almost known, and I think we should take that opportunity. I I will stop here, and Corey, I will ask a, Councilman Black, who is our chairman of the Health District Board of Health, please.
Thank you, Dr. Legan. I really appreciate the opportunity to say a few words. Thanks to the members of the media for being here and covering our progress and our efforts. We've all had a difficult time over the last many months, but I'm excited to say that we're reaching a milestone here in our community regarding the response to the coronavirus or the COVID pandemic. For the last 15 months, I've been fortunate to, as the chair of the Board of Health and a city councilman, see an amazing collaboration between all the agencies in our area, not only dealing with coming up with and enforcing mitigation plans, but also the testing earlier on. And then, of course, as we moved into the vaccination campaign, the efforts that we've put in, as well as the cooperation and the efforts from the community, have gotten us to this really pivotal time that we're at now, the opportunity to reopen our community. As we enter into this new stage of the response, it's very, very incumbent upon all of us to do our part continually to keep fighting against the coronavirus pandemic. If you haven't been vaccinated, I encourage you to strongly consider doing so. We're only getting to this point and giving us the ability to open things up because of the high level of participation that we have had with the vaccination. As a matter of fact, I'm not in my office. I'm here with some friends of mine at the Silver Mesa Rec Center, seniors. You see all my, say hi, friends. So my friends, they invited me over for lunch today here at the senior center out at Flores Park here in North Las Vegas. The reason we're able to do this is because I didn't pull anybody because it's none of my business, but I believe that based on the statistics, at least 80% or more of these awesome seniors have gotten vaccinated. I'm vaccinated. We're here enjoying things that we otherwise wouldn't be able to do safely. So they let me crash their party and have my briefing right here. So really the bottom line is we're at a turning point. We need to not let off the gas. We need to be able to move around freely and do our part. If you had the vaccination, you're able to do that with confidence. If you haven't been vaccinated, please protect yourself, protect others. Be smart about it. You can get vaccinations, like Dr. Legan said, at the convention center, at the drive-through, at the Texas. It's never been easier or more convenient to take your shot. I wish the CDC guidelines of removing the masks and the reopening was evidence that we're 100% done with the pandemic, but we're not. It's still among us. And if we keep doing our part as community members and as community leaders, I think we'll keep going in the right direction. So thanks, Dr. Legan, for the opportunity to speak.
Okay, thank you.
And thanks to my friends here at the Rec Center. They're happy about the vaccine.
Thank you. Okay, Corey, we can go to the questions now.
Excellent. Okay, we're going to open it up for questions. Everyone remember to use the raise hand feature if you'd like to ask one. And when we call on you, be sure to identify who you are and what media outlet you're with. First up today, Jacqueline.
Hi, good afternoon, everyone. I know that certainly, as Councilman Black mentioned, those who are 80 and plus, they are doing great regarding the vaccination rates. They are overachievers, so to speak. But those in their 20s to 40s are lagging. I know you guys have some interesting and cool and crazy vaccination events coming about. The one at the Larry Flint Club is going viral. Why are the young people lagging? And how do we try to have them step up, so to speak?
Okay. Dr. Love, you want to take that one?
Yeah, this is Dr. Wolf. I'll certainly try to answer that question, and perhaps maybe Joanne can step in as well. So it's likely just a combination of factors. I think it's, especially for young people, perhaps it has to do with the fact that they may not feel very highly susceptible to the infection, or certainly not to severe disease or hospitalization, which is probably the reason why they're not stepping up to get vaccinated in as high numbers as our seniors are. But I think it's important to remember for that population that they can get infected and they can spread the virus to other people, even though they may not get very seriously ill or be hospitalized as a result of that infection. But it's still important for them to get vaccinated, again, to protect others in their family and in their community.
Our next question today is from Mary Hines. Trying to unmute you. There you go.
Thank you and good afternoon. Are any of you hearing of any confusion or conflict surrounding the new mask guidance? For instance, people who are saying they don't need to wear a mask in an establishment that requires one.
Okay, thank you, Mary. I will try to answer that, and then anyone from my peers here can follow up. Yes, actually, as you know, the CDC latest update in the use of masks was something that, of course, took by surprise most people, even most state and local authorities, and of course we have to follow up from there. We do know that the CDC is working in complementary documents to share with the public to actually help businesses and the community address the questions that this latest guideline brings. Having said that, the CDC recommendation for vaccinated people, which basically says that if you are fully vaccinated, you can go back to normal life, meaning that you can behave as you used before the pandemic came across, except when you travel, whether it is a plane or public transportation or also in healthcare settings as well. But the CDC document also mentioned that even so they make those recommendations for people who are fully vaccinated, still state, local governments, and businesses are able to do their own requirements. In other words, a business, any local business today, if they decide that they want to require and enforce the use of masks from all the customers, they have the right to do that. The CDC latest recommendation doesn't prevent any business from doing that. So that's something that is important to recognize, that the recommendation from the CDC is for those who are vaccinated. They can do again live as before, but there are certain limitations, and then businesses and local government or state, they might decide to do differently.
Our next question today comes from Christian Cesares.
Hey there, good afternoon. This is Christian with 8 News Now. My question is, as more venues are starting to operate at larger capacities, any timeline as to when we can expect T-Mobile Garden Arena to be operating at full capacity?
Sure. Actually, the, the county commission yesterday, they have the June 1st is actually the day when the current mitigation plan will be, I would say, stop or not, not viable any longer. Meaning that coming June 1st, business can go full capacity and just back to what we call pre-pandemic behavior, if you wish. So I don't know if the Chief Steinbeck, who I don't see him now, but he was here. If there is anything else that I could miss him, but basically that's what it means. By June 1st, business can go back to full capacity.
I see a couple of hands raised for follow-up questions. We will get back to you after we take all first-time questioners. And we will, like I said earlier, save the Spanish till the end. Oh, Chief Steinbeck, you're there. Did you have something to add to what Dr. Legin was saying?
I don't. He got it exactly right. I don't have anything to add to that.
Thank you. Sorry to interrupt your lunch. Next question today is from John Trainer. If I can unmute you, hold on.
Yeah, hi,
There we
kind of a two-parter, but both about younger people. One, we're seeing other states doing kind of creative things to entice people to get their vaccine. Are we trying to think outside the box, not just location-wise, but with incentives to younger people to get vaccinated? And the second part of that, we're going to see day clubs and clubs starting to operate at capacity. They typically have younger audiences who majority have not been vaccinated. What does SNHD do to look at potential spikes or surges or cases in those areas?
Okay. Well, our surveillance system will still be working, and we still are monitoring the disease, and we will continue monitoring the disease for a long time. So we have our contact tracing workforce. We have also our we call senior disease investigators. So we have a full system already in place to look at the behavior of the disease in this community. Yeah, right now our capacity to investigate those cases is actually beyond the number of cases that we are seeing right now, and we are at this point where every single case is becoming more and more important, because so now we are going into perhaps, you know, the what I will expect to be the declining phase of this pandemic, and that's when you really have to identify every single case, and you have to be being able to educate every single contact just to prevent transmission in the community and try to make sure that the disease is no longer disseminating among our community members. So I will also ask Chief Cassell to talk a little bit about nightclubs and younger congregations, because I know he has some ideas.
So yes, thank you, Dr. Gann. This is Greg Castle. We've had some conversations about enticing, doing raffles and so forth like that. I'll be honest, they never grew legs. There's always an issue where if you want to give away, $100,000 or a house or something like that, it sounds real easy to do, but it's actually not that easy. We reached out to some places here in the Valley to look for some financial support for things of that nature, and we didn't get a lot of positive feedback on that. So I admire what they did in the state of Ohio with their lottery thing, or their $1 million raffle that was put up by the state, and or the 4-year tuition for younger person that maybe would win the raffle, but we haven't been able to pull any of those things off right now as of today.
Joanne, you wanted to say something?
Well, I was just going to say some of the employers are offering incentives to their employees. And, that is certainly very helpful. A lot of the research that shows about vaccine hesitancy is that usually bribery doesn't work real well. So it just kind of depends on the reason that people don't want to get vaccine. And we need to focus on those reasons, and whether it be access or whether they have doubts about the safety. We will use our usual public health initiatives of education, access, and getting parents informed about the best action that they want for their children.
Cody?
Just seeing what other questions, if we have anything in the chat. 1 second. Okay, I think that probably covered April's questions. Chief Castle, would you like to take a moment and go over any of our upcoming clinics and discuss the closures at the big pods?
Absolutely. So again, Greg Castle here. We are planning out our clinics and opportunities for vaccine through August 9th at this point in time. Obviously, we have some significant slowdown, and there's a staffing meeting going on in the other room at this moment. We still have Texas, Las Vegas Convention Center open, plus some of our homebound operations and a few various pop-ups going. The last day of operation for the Las Vegas Convention Center is June 19th. And the last day of operation for Texas Station is Monday, June 21st. At that point, all large pods, things that are north of 600-700 anticipated or potential doses a day will be a thing of the past, which is good news. And the health district will transition into, we have a plan built out right now to do a school. If you take, the Las Vegas Valley proper and you cut it into quadrants, northwest, and so forth, southwest, northeast, southeast, we're going to do one school every day for 4 days. And then the next week we'll go do 4 schools in another district. Each of those quadrants will have a school done. So we'll do 4 schools a day for a total of 16 in a week. And then we will double back there, 3 weeks later to give the second shots. It'll have right now on the plan is for Pfizer and Janssen to be given. And that gives us the 3-week turnaround. So that's going to happen, through the month of June and into the very early parts of July. And then in July, a little bit of an overlap there. We'll have some sites set up that are currently on the board right now for the CSN sites here in Southern Nevada and UNLV. And those will run us through August 9th. I also want to really, really, really stress that probably the easiest place for anybody to go get their shot is at their local pharmacy. Every pharmacy in town that I know of is doing this. Smith's, Albertson, Vaughn's, CVS, Walgreens, Walmart, Sam's Club. They're all doing it. And so we really want to stress that to go to one of these sites, you may drive by 10 pharmacies that are doing the same thing and have availability. If you type in the website, albertsons.com, smiths.com, and so forth, at the top of every one of those websites is a box that says, click here to schedule your free COVID vaccine. So probably the simplest way for anybody to get that is to go to their local pharmacy. And from the health district standpoint, I'm sure Dr. Legan and the team will agree, we don't care where you get it, just get it.
Right.
We're going to take a couple of quick follow-up questions, and then we'll move on to the Spanish language portion of today's briefing. First up with a quick follow-up, Jacqueline.
Hi, everyone. Again, certainly youth in the 12 to 15 age range is lagging. It's barely 1 percentage point across the valley and the state. Is this concerning, or is this a matter of health officials being patient, waiting to see their pediatrician, kind of parents asking more questions? A very different scenario with kids than with adults.
Okay, thank you for the question. Well, first, we need to emphasize that 12 to 15 years old was just approved last week. Also, please keep in mind that many children are now in the final days of the school year, and parents at this point are very concerned about how to end the school year than getting that shot quickly. So in addition to that, one of the things that came out with the FDA and then the CDC approval of this age group is that the vaccine can be administered simultaneously with other vaccines, which is very important for us because as some of you might know, now every year during the summer we have what in public health we call the school rush, where thousands and thousands of children are just brought to the clinics, whether it is the public health clinics or the pediatricians, to get the shots before they go back to school. And that's going to be a great opportunity for us. And by us, I mean the whole health system here in Clark County, to be able to offer and administer the vaccine to the children. So in other words, right now we have about 4,500 children between 12 and 15 years old vaccinated here in Clark County. At this point, it's not a reason of concern for us, because we know that we have time to reach the children, especially during the activities of the summer rush that is just coming, and we are preparing for that. Joanne, please.
Right, yes. So what we will be planning to do is, and parents need to start thinking about this, is as we're offering COVID vaccine, we'll offer all the other school related vaccines as well. And so we are planning to offer that probably July, August, as children are preparing to go back to school. We will be busy. I encourage parents to get back to school vaccines right now, because remember, we're kind of a couple of years behind. So we plan to be very, very busy this summer getting children back to school with their needed vaccines. And so and also for the healthcare providers, the state and our agency are also setting up a system where pediatricians and family care practitioners, they can get the Pfizer vaccine so that they can give it to their adolescents as they're coming in for their well child visits and for school visit, or sports physicals and things like that. So, so if there's any question about that, they can contact our agency to find out how to access those vaccines.
Let's move on to a follow-up from Mary.
Hi. When are you beginning the vaccinations at the schools? And is that an effort targeting the 12 to 15-year-old age group? At those events, will other vaccinations be available?
The first round, we're doing like a 2-3 week interval at different schools. They're going to be at middle schools and high schools. So we are targeting that 12 to, really 17-year-olds. And so at that first round, we are just offering COVID, but the next round, we're coming back to do the second dose. And then we'll also be hoping to offer the back to school vaccines as well. But parents don't have to wait. I mean, they could, schedule something with their physician to ask questions, and then also, think about maybe getting those vaccines early.
Thank you all for the great information today. Before we move on to the Spanish language portion, does anyone have anything else that they would like to add or report on? Dr. Loaf, Joanne?
Go ahead.
Go ahead, Chief, please.
Oh, I was just going to add to what Chief Greg Castle also said, about how we've worked really hard to try to make it convenient for people to get the vaccine. And we are sometimes, I wouldn't use the word surprised, but it is amazing that, some people will choose to get the vaccine if it's convenient, but they don't have quite the same resolve or passion to go get it if it's not convenient. We're addressing that the best that we can by simply making it as convenient as we can at so many different sites. We understand that it's not always just a vaccine hesitancy, but it's also just how high of a priority it is for some people, and people working really hard and they're busy at their jobs and they're still taking care of their children and everything that goes along those lines. So sometimes when we're at whether it's the employee sponsored vaccine clinics, or it's the ones that are out in the community, the smaller pods, or if it's a matter of somebody having some transportation issues, we're still committed to try to make sure that we get this available to everybody, and every vaccine that we get done, we look at as a win.
Yeah, I just wanted to make a brief comment because yesterday I was at this meeting and I noticed that there seems to be the impression about some parents here in the community that the vaccine is mandatory for children. So we just want to make sure that everybody understands that those vaccines are not mandatory for children or adults. At this point, the vaccine for children is something that is a decision of the parents, whether they vaccinate the children or not. We strongly encourage all parents of this community to make the right decision and vaccinate the children. But I just want to make sure that everybody understands that we are not mandating the vaccine. That's nothing like that. And just I would leave at that. Thank you.
And I just wanted to mention too that getting the vaccine and now not having to wear a mask, it gives a sort of freedom, I would say, a sense of freedom. And I felt relief getting the vaccine. And I think for parents, sending your children out, it's going to be summertime, they're going to be with their peers. You want them to enjoy their childhood. You want them to enjoy getting back to being a teenager with their peers. So to me, it would seem a relief to get them the vaccine, and you don't have to worry about that now. And you can do their normal activities, back to baseball, back to sports, and you don't have to worry about it. So to me, that feeling is very important and should be considered when you're thinking about vaccinating your child.
And I would like to throw in there that at the beginning of this press conference today, it was mentioned about the collaborative work of all the partners getting this stuff out to the community and so forth. And I want to make sure that you, the media, all know that we consider you as part of that loop.
Mm-hmm.
You guys have given us ample opportunities to deliver this message across multiple languages and multiple venues. I know many in this teleconference from our side of the fence have done these things. I've done them in parks. I've done them in my house. I've done them driving down the street. So we really appreciate the opportunities, you guys, because that's how the word gets out. We really do think of you as a partner and a significant key to this success.
Absolutely.
Thank you, everyone. And to anyone who's listening in, I just wanted to reiterate that we do keep our vaccination location list updated regularly on our website at www.snhd.info/COVID. That will include all the locations that we're affiliated with. It'll have booking links. It'll say which ones are walk-ins, and there's no shortage of places to go. So get out there and take your shot to stop COVID-19. Thank you all for joining us. And at this time, we will be moving on to the Spanish language portion of this media briefing with Dr. Leguen. And if you do have a question in Spanish, please use the raise hand feature at this time. First up, we have Alexander Zapata.
Thank you. Doctor Leguén, quisiera, si hay posibilidad de que comenzara con el update que dio al inicio en español y después de eso hacerle una pregunta. No sé si es posible.
Claro, sí, por supuesto. Gracias, Alexander. Sí, en el día de hoy estamos aquí con la intención de proveer un dato más actualizado de dónde se encuentra nuestra campaña de vacunación contra el COVID, así de como cuál es el estado de la pandemia en nuestro condado Clark. Hasta el día de ayer, un total de más de 970,000 personas han iniciado la vacunación contra esta enfermedad aquí en el condado Clark. Eso representa casi un 53% de las personas elegibles para ser vacunadas en el condado. También más de 758,000 personas han completado la vacunación contra el coronavirus, ya sea recibiendo las 2 dosis de la vacuna Pfizer o las 2 dosis de la vacuna Moderna, o aquellos que recibieron una dosis de la vacuna Johnson & Johnson. En total, hemos administrado en el condado más de 1,660,000 dosis de vacuna en estos meses. Aún así, también queremos recordar a la comunidad que el condado ha sufrido grandemente los embates de esta pandemia. Más de 249,000 personas han sido confirmadas con esta enfermedad. Muchos de ellos, miles de ellos, tuvieron que ser hospitalizados y desgraciadamente hemos perdido más de 4,000 vidas debido al coronavirus. La buena noticia es que desde principios de enero de este año, ya incluso antes de comenzar la vacunación, ya empezamos a ver una disminución en el número de casos reportados por esta enfermedad. Esto se ha acentuado mucho más según la campaña de vacunación ha progresado y en estos momentos el número de casos reportados diariamente en el condado Clark es bastante menor de lo que vimos hace 5 o 6 meses atrás. También hemos visto que la tendencia en el número de personas hospitalizadas o las personas que fallecen por esta enfermedad ha disminuido dramáticamente en el condado Clark. Otro elemento importante, evidencia de la disminución en la transmisión del virus en el condado Clark, es que el índice de positividad de las pruebas de coronavirus aquí en estos momentos es 4,8%, o sea que ya el condado Clark tiene una positividad de la prueba que es menor de 5%, que es el nivel recomendado por tanto la Organización Mundial de la Salud como el Centro de Control de Enfermedades de Atlanta. O sea que esto es muy importante porque esto es un indicador de que la transmisión del virus en esta comunidad ha disminuido significativamente y está en estos momentos a niveles relativamente bajos, pero aún así tenemos que mantener nuestros esfuerzos y tenemos que hacer posible que más personas se vacunen para que la posibilidad del virus de saltar de una persona a otra cada vez sea menor. Mientras más personas estén vacunadas en el condado, menor será la posibilidad del virus de seguirse reproduciendo en nuevas personas infectadas. También quería decir que nosotros seguimos manteniendo las operaciones de vacunación en el Centro de Convenciones de Las Vegas. Allí se está ofreciendo la vacuna tanto a las personas que vienen, digamos, caminando o a pie, como a las personas que hacen el servicio por lo que se llama el drive-thru, o que solamente sin bajarse del carro también son vacunadas. Se está ofreciendo estos dos servicios allí. Y en el casino Texas Station se está ofreciendo el servicio de drive-thru, o sea que las personas van con su carro sin bajarse del carro, reciben la vacuna y son observadas por 15 o 30 minutos y después ya se pueden ir. O sea que además de eso, estamos ofreciendo la vacuna en más de 8 o 10 sitios en el condado en los cuales las personas pueden ir y son cerca de su vecindario y ser vacunados. Esta es una información que está disponible en nuestra página web. Allí pueden encontrar todos los sitios que se están ofreciendo en este momento la vacuna a través de nuestro personal. Alexander, yo voy a parar aquí y entonces otra pregunta. Corey, any other question?
We do have a question. Ms. Bell from Telemundo is joining us for the first time. Trying to unmute you now. There you go. Go ahead. Ms. Bell, can you hear me? Okay, we can come back to you in a moment, Ms. Bell. We can't hear you at this time. We've got a follow-up from Alexander.
Thank you, Corey. Doctor Leguén, un par de cositas nada más que me quedan pendientes por preguntarle. La primera, para el 1 de junio no vamos a estar al 60% de la población elegible vacunada. ¿Por qué eliminar las restricciones cuando todavía no se llega a esa inmunidad de rebaño? Y la segunda es cómo avanza la vacunación en los jóvenes de 12 a 15 años y hablarnos un poco de eso, lo que van a hacer en las escuelas. Serían esas dos partes. La primera, ¿por qué levantar las restricciones si no llegamos aún a la inmunidad de rebaño el 1 de junio? Y cómo avanza la vacunación de los niños de 12 a 15 años y los eventos que van a tener la escuela para explicar a los padres.
Seguro. Gracias, Alexander. Bueno, en este momento el índice de vacunación aquí en el condado está, o sea, para el grupo elegible, cuando se hizo esta discusión con los comisionados, en este momento está al 53%. Nos faltan casi 2 semanas para llegar al 1 de junio. Es posible que el 1 de junio no hayamos llegado al 60%. Estaríamos cerca, pero es posible que no lo sabemos. Pero la decisión de levantar estas restricciones el 1 de junio está basada en el hecho de que el Centro de Control de Enfermedades de Atlanta hace unos días atrás, el día 13, creo que fue el viernes, bueno, no recuerdo ahora, ellos hicieron una nueva recomendación acerca del uso de máscaras y la distancia social para las personas que están vacunadas. En esas recomendaciones del Centro de Control de Enfermedades de Atlanta, las personas vacunadas pueden retornar a lo que se considera la vida normal antes de la pandemia. O sea, que pueden estar tanto en espacios al aire libre como dentro de edificios sin usar la máscara. Desde el punto de vista de lo que son los inspectores, las personas que digamos, que hacen el seguimiento de las leyes o restricciones, es virtualmente imposible hacer la determinación de quién está vacunado y quién no está vacunado. Y de la única forma que ellos pudieran hacer esa determinación es preguntándole a las personas, oiga, ¿usted está vacunado, sí o no? Y sabemos que el hecho de tratar de hacer ese tipo de investigación al público es algo que puede resultar extremadamente conflictivo y que incluso atenta contra las libertades individuales de la persona. O sea que eso crea un reto bastante grande desde el punto de vista de las regulaciones que están recomendadas aquí en el condado. Nosotros tuvimos en cuenta eso en primer lugar. En segundo, el hecho de que la vacunación en todo el país está a niveles bastante elevados. La población adulta en los Estados Unidos, de acuerdo con las declaraciones de la Casa Blanca y del Centro de Control de Enfermedades de Atlanta, en adultos está ya a un 60%. Y como sabemos, en estos momentos, la mayoría de las personas que vienen a Las Vegas son mayormente de orígenes de otros estados más que del exterior por las mismas razones de las limitaciones en turismo y eso que existen en estos momentos con el comercio internacional. Eso y el hecho de que nuestra población en estos momentos está ya más de un 50% y que para el 1 de junio vamos, si no hemos llegado al 60%, vamos a estar bastante cerca del 60%. Realmente favorece el que tomemos esa decisión y no el hecho de querer mantener algo que va a ser extremadamente difícil de implementar porque tiene ese reto de cómo en cualquier sitio público tú haces la determinación de quién está vacunado o quién no está vacunado. Entonces, lo que sí, esto conlleva un reto desde el punto de vista educativo nuestro a la comunidad, sobre todo a las personas que no están vacunadas, para que se vacunen y también para que respeten y protejan a otras personas cuando ellos estén en sitios públicos y sepan que deben usar la máscara porque ellos realmente no están protegidos. Y al mismo tiempo también sirve como, en este caso, como un estímulo. Las personas sepan que cuando están completamente vacunadas, pues pueden resumir sus actividades normales de la época antes de la pandemia, aunque aún existen ciertas limitaciones cuando se trata de elementos relacionados con transporte público, como sabemos, los aeropuertos y ¿sabe? Los autobuses y estos sitios, pero en el resto de las actividades, estas personas que están completamente vacunadas pueden resumir su vida hasta normal, hasta la época antes que empezara esta pandemia. Cory.
We're going to circle back to Jamie Bell from Telemundo, see if this works this time. Trying to unmute you. Unfortunately, we can't hear you. Can you hear us?
Que te mande, Cory, ask her to send you the question through the chat. And then you can have that.
Let's see if she can. She joined us from her phone, I believe. Let's see. Yeah, if you can type into the chat box, please do. Oh, Alexander actually says that what she's wanting to know is about the school vaccination process.
The school vaccination process. Ok. Bueno, en estos momentos no hay, o sea, no hay un sistema de vacunación contra el COVID en las escuelas. Eh, lo que existe en estos momentos es que, como sabemos, la vacuna Pfizer fue aprobada para los niños de 12 a 15 años, o sea, de 12 años en adelante. Y nosotros estamos ofreciendo la vacuna a estos niños en los mismos sitios que estamos ofreciendo vacunas al resto de la comunidad. Ahora, una de las cosas que dijo el Centro de Control de Enfermedades de Atlanta y la FDA cuando aprobaron la vacuna es que la vacuna se puede poner al mismo tiempo que otras vacunas. Y si ustedes recordarán, una de las cosas que se dijo al principio de la campaña de vacunación es que la vacuna tenía que estar al menos 14 días separada de otra vacuna que se hubiera puesto la persona. Esto ya la semana pasada, cuando la vacuna en los niños de 12 años en adelante fue aprobada, esa recomendación se cambió y ahora autorizan que la vacuna se pueda poner conjuntamente con otras vacunas, lo cual es muy importante porque ahora mismo ya estamos a pocas semanas del proceso que sucede todos los veranos, que es de los niños con los padres corriendo para vacunarse, porque antes de empezar el próximo curso escolar, las escuelas le están exigiendo su certificado de vacunación y todas estas cosas. Entonces, eso significa que cuando nosotros estemos ofreciendo vacunas para el regreso a escuela, ahora en el verano, entre las vacunas que le vamos a ofrecer a los niños están las vacunas que las escuelas requieren que los niños tengan, que es la razón por la cual la mayoría de esas familias van a estar en estos sitios de vacunación, pero vamos al mismo tiempo ofrecerles también la vacuna Pfizer, en este caso, que es la que está aprobada para ese grupo de edad, para que también la reciban. Es importante señalar que la vacuna contra el coronavirus no es obligatoria para los niños y lo estoy diciendo ahora porque eh, hemos visto en días recientes que parece existir una confusión en partes de la comunidad, que hay padres que le han dicho o han recibido información de que la vacuna es obligatoria para los niños. En estos momentos, esta vacuna no es obligatoria para los niños. Es una decisión de los padres si se la ponen al niño o no. Nosotros sí recomendamos y recomendamos fuertemente que, que los niños reciban esta vacuna, pero repito, la vacuna no es obligatoria para los padres. Ok, Corey.
Thank you so much, Dr. Ligon, and thank you to everyone who joined us today. At this time, this does conclude today's media briefing. And if you haven't done so already, we do encourage you to get out there and take your shot to stop COVID-19. Have a great afternoon, everyone.
Okay, Corey, thank you.